Today, we are going to discuss about the concept of social safety nets. We all know about the concept in the name of different social welfare programs. It is the concept to protect the vulnerable or marginalized group in a country or a region. So, the definition, coming to the definition of social safety nets, uh, is it is a it is also called socio-economic safety nets. That is a it is a non-contributory transfer program seeking to prevent the poor or those vulnerable to shocks and poverty from falling below a certain poverty level. That means it is a socio-economic safety nets. It's also called socio-economic safety nets. It is a non-contributory transfer program. That means it is maybe the contribution from the part of people is not mandatory actually in this kind of social safety programs. uh, that's why the non-contributory, that is completely under the government, it is completely under the public sector. So it is a non-contributory transfer programs to prevent the poor from poverty or any other shocks. So that is a very important thing. And social safety net programs can be provided by the public sector. That is also I mentioned in the earlier paragraph. That is in the form of donorship or and some other kind of aid from other parts of the government or non-governmental sector. And it is a also under the uh, private sector also, that is a it is given to the vulnerable groups, especially marginalized groups, or the people who are living in the below poverty line. That is a it is provided by, actually it is provided by the government or non-governmental organization or private firms, and in the form of charities, and in the form of informal household transfers. And this is the kind of protecting mechanism by the government or other organizations uh, to uphold or to improve the conditions of the vulnerable or marginalized groups, especially who are facing some difficulties of poverty or unemployment or any some other kind of problems. Uh, this is a social safety nets. And uh, according to the World Labour Reports 2000, it is some kind of old uh, report. The broad social security established in India, the policy is not coherent. That is, here public expenditure on social security in India is only 1.8 percentage of GDP. So it is nearly low level as we compare to Sri Lanka or China. And in 2014, uh, especially 1.6 percentage of their GDP on social safety nets on average. And this is very low compared to other public policy measures such as fuel subsidies, which do not target the poorest. Especially, there is a strong and growing body of evidence that social safety nets are one of the most cost-effective ways for countries to end the extreme poverty level and promote shared prosperity. That is very important thing. Here nowadays, especially the countries are accepting the neoliberalistic agenda for promoting the welfare of the people, and it or they cut down the important aspects of the welfare measures to the poor people. That in that condition, actually we have social safety nets to prevent the problems, especially facing the vulnerable or marginalized group in the country. This is very important thing. And three countries, especially India and China and Brazil, have the largest social safety nets programs in the world. So we have some kind of social safety net programs, especially and account for almost half of the global coverage. So lower income countries are learning from their experiences. So this is a very important thing. We have underdeveloped countries and we have some kind of developing countries, and we India, with the Indian people are living in the below poverty line. The most large number of people are living in the below poverty line. So it's the three countries in the world, especially India and China and Brazil, we have social safety nets program. China have social safety nets program, and Brazil have social safety nets program. This is very important thing, and this is a social protection programs in India can be broadly categorized as especially we have classified these social protection programs in India into four categories: to improve the living conditions of the poor, to target the social security programs for the very poor, and third one, social security measures for unorganized or informal sector workers, that we already discussed in the classes, in the previous classes. And fourth one, social security measures for organized or formal sector workers. That is very important thing. So we have to consider these four categories, especially for improving the living conditions of the poor. India have Sarva Shiksha Abhiyan. It's a educational program. Indira Awas Yojana, it is a housing scheme, and we have integrated child development services, that is ICDS, that you have worked in the especially social work students are working in the field of ICDS sector, and we have National Health Mission, and we have Annapurna scheme. These are the examples. There are a lot of other schemes are there. And second category is targeted social security programs for very poor. So it is a targeted programs for the very poor people. We have MGNREGA. These are only examples, some of the examples of the programs. We have a lot of programs. MGNREGA for securing the employment opportunities for the poor for 100 days. We have already know. The Indira Gandhi National Old Age Pension Scheme, we all already avail. Largest number of people are beneficiaries of this scheme in Indira Gandhi National Old Age Pension Scheme. And we have Indira Gandhi National Widow Pension Scheme, Indira Gandhi National Disability Pension Scheme, Rashtriya Swasthya Bima Yojana. It is a health coverage scheme. You have to look at these programs. If you look at these programs, you have observed that you can observe that these things are for very poor people, that is marginalized or vulnerable group in the country. MGNREGA for the unemployed person, the poorest unemployed person. Indira Gandhi National Old Age Pension Scheme for old age people, that is a very vulnerable group in the country. And Indira Gandhi National Widow Pension Scheme, widows are very much poor in the country. And in Indira Gandhi National Disability Pension Scheme, we have disabled people for the protection of them. We have Indira Gandhi National Old Disability Pension Scheme, and we have Rashtriya Swasthya Bima Yojana for below poverty line patients under the coverage of 30,000 in the former year. Now it has increased to 5 lakh. That is a other name regarded for this program, and this is that targeted for especially for social security for the very poor. And third one, social security measures for unorganized or informal sector workers. That is not from the government sector. They are receiving lowest salary as compared to largest sector. And this kind of programs have been mentioned in the slide for the unorganized or informal sector workers. Handloom Weavers Comprehensive Welfare Scheme, that is for handloom weavers. National schemes for welfare of fishermen and training and extension, that is for improving the conditions of the fisherman community. Aam Aadmi Bima Yojana, Rajiv Gandhi Shilpi Swasthya Bima Yojana, that is very important thing. That this is for health scheme for the unorganized sector, especially people who are working in the field of building sector. That's a kind of Bima Yojana for the Shilpi, in the form of Shilpi for handicraft and artisans. And another category is social security measures for unorganized formal sector organized formal sector workers, and this is for purely for organized or governmental sector workers. The Employees Compensation Act, Maternity Benefit Act, the Employee State Insurance Act, Rajiv Gandhi Shramik Kalyan Yojana. This is very important. Also, we have inclusive approach for the protection of all the people in the country. We give importance to the welfare of the people, that you can see in the slide. So moving to the next slide, improving the living standard of the poor, that we already mentioned in the Sarva Shiksha Abhiyan. It is education for all. We have Right to Education Act. It is enacted in the 2019 and enforced from 2010. And this is Sarva Shiksha Abhiyan launched in the 2001-2002, and it is we all know about the Indian government is providing free and compulsory education for up to the age of 14 years from 6 years. It is to strengthening the educational needs of the children, especially we expanded the infrastructure facilities by opening the new schools, construction and renovation of school building. We provided we are providing textbooks and uniforms for the children, especially 194 million children are studying in the government and non-governmental schools. Especially in governmental school, we are providing free meals for every students, free books for every students, free uniform facilities for every students. So this is very important scheme. This is to protect the educational needs of the children. We especially Article 21A provides the right to education. As a part of that, we enacted the Right to Education Act in 2010. This is very important scheme for the welfare of the children in the country. Next is housing. This is only examples. There are some other programs for the welfare of the all the sections of the country. For housing scheme, Indira Awas Yojana, now it is renamed as Pradhan Mantri Awas Yojana. It is a target group of public housing scheme for the poor and who are below poverty line houseless families. It is identified through Gram Sabhas and ward councillors, especially. They are getting financial support from the central government and state government for secure the needs of the especially housing needs of them. This is a financial assistance from 70,000, and now it has increased to 4 lakh, especially 4 lakh per household. And another category is drinking water and sanitation. So National Rural Drinking Water Program, especially it is to provide adequate drinking water facilities for all the people of the country, especially domestic need. So especially basic need, one of the basic need, one of our basic needs is safe drinking water facilities. So it's a very important thing. for all the sanitary or all the households or all the people of the country have been providing the national rural drinking water facilities, especially for rural areas. And another in child nutrition area, we already know about the integrated child development services, especially it is implemented in the year 1975 with the objective of improving the nutritional and health status of the children, especially in the age group of 0 to 6 years to reduce the infant mortality rate, morbidity rate, and reduce the malnutrition, especially and thereby the increasing the capacity of mother to look after the health and nutrition needs of the children. Especially nowadays 89 or above 100 million children are the beneficiaries, children and mothers are beneficiaries of this program. It is also covered for the welfare of the program is also covered for the welfare of the pregnant and lactating mothers. Another scheme is midday meal scheme. We all know about the midday meal scheme. Up to the age of 8th class, we provided, especially schools are providing the hot cooked midday meal with the stipulated nutritive and calorific values. Especially the 120 million children are the beneficiaries of this program. And targeted public distribution system. It is very important. We already know about the targeted public distribution system, especially in the subsidized rate food grains distributed in the form of distributed through ration shops, and this it is for disadvantaged population sector, especially National Food Security Act. It is come under the National Food Security Act, which then provides statutory food security to all the vulnerable group. And it is there is another program, Annapurna scheme. Annapurna scheme, it is intended to provide 10 kg of fruit grains for per month free of cost to all such persons who are through eligible for old age pension under National Old Age Pension Scheme are presently not receiving it. Especially this is very important scheme under the Annapurna scheme. A national floor level minimum wage, especially apart from both the central and state government fixing minimum rates of wages under the Minimum Wages Act 1948, especially the central government fixes the national floor level minimum wage, raising it from time to time. It presently stands rupees 115 per day in 2011. It has increased to 2021. It has increased to 130. It is not sufficient actually, but government has been increasing this amount every time, especially time to time. Another category is self-employment and wage employment scheme. There are a lot of schemes under this segment. Swarna Jayanti Gram Swarozgar Yojana. It is a financial assistance is provided to the below poverty line members' families, and for creating income generating assets through a mix of bank credit and subsidy. Another program is Swarna Jayanti Shahari Rozgar Yojana. It is coming under the urban sector, urban areas. And Prime Minister Employment Generation Program PMEGP, and it is aimed at generalizing self-employment by providing credit-linked subsidy for setting up of micro enterprises. It is for providing the micro enterprises and targeted social security programs for the very poor, especially it is very important schemes, especially Mahatma Gandhi National Rural Employment Guarantee Act. We all know about the program is guaranteeing the 100 days of wage employment in a financial year to a rural household. A national social assistance program, especially pension, Indira Gandhi National Old Age Pension Scheme, Rupees 200 per month from the central government. In addition, state government provide old age pension ranging from 200 to 1000 per month. Especially in Kerala, it is raised to 1600. Indira Gandhi National Widow Pension Scheme, especially is given to the widows aged between 45 to 64 years of age. It is coming for the this program is only for the BPL household. The pension amount is rupees 200 per month, and the state government concerned is also expected to provide an equal amount to the pension, 400 rupees. A national social assistance program pensions, especially Indira Gandhi National Disability Pension Scheme, especially 80. It is for the age category of 18 to 64 years of age, and who are suffering from severe or multiple disability. And this pension is also giving 200 per month by the central government, and state government concerned is also expected to contribute an equal amount. In the health sector, especially over international statistics states that over 300 million people in India live in the extreme poverty, and over 500 million or less than US dollar to a day. Only half of the population has access to piped water, and most health services are paid or for out of pocket, and making India's health system is the biggest private health services in the world. So health sector, we have the program National Health Mission. Earlier it was known as National Rural Health Mission. It is now known as National Health Mission. It is in order to provide health security, especially to women, children, and the poor residing in rural areas. And it is launched in 2005. Major goal is to reduce infant and maternal mortality rate, and it is for prevention of communicable and non-communicable diseases, etc. Another scheme is Janani Suraksha Yojana. It is for pregnant and lactating mothers. Especially, it is launched in 2005 for it is a safe motherhood intervention under the NHM. And it is being implemented with the objective of reducing the maternal and neonatal mortality by promoting institutional delivery among poor pregnant women. Janani Suraksha Yojana, as a part of Janani Suraksha Yojana, we have ASHA package, accredited social health activist package of rupees 600 in rural areas, include rupees 300 for ANC component, and rupees 300 for facilitating the institutional delivery. ASHA package rupees 400 in urban areas, include 200 for ANC component and 200 for facilitating institutional delivery. In HPS, especially only BPL and SCST women delivering in government and accredited private institution are eligible. Cash assistance for home delivery is rupees 500 is available for only BPL pregnant women. It is now distributing. And earlier age is above 19 years, and parity up to 2 live births restrictions are removed. And for mothers, Janani Shishu Suraksha Karyakram, and it is a free and cashless delivery, free C-section, free treatment of sick newborn up to 30 days, exemption from user charges, free drugs, free diagnostics, and free diet during stay in the health institution, 3 days in case of normal delivery and 7 days in case of cesarean section, and free provision of blood, free transport from home to health institution and equally health institution to home, free transport between facilities in case of referral, as also drop back from the institution to home after 48 hours stay. For infants, especially for infants, the following are the free entertainments under the sick newborns till 30 days after birth. Similarly, include free treatment, free drugs, free diagnostic, free provision of food, exemption from user charges, free transport from home to health institution, free transport between facilities in case of referral, and free drawback from institution too. And another category, another section is social security measures for unorganized or informal sector workers. In order to ensure the welfare of the workers in the unorganized sector, which include weavers, handloom workers, fishermen and fisherwomen, toddy workers, and leather workers, plantation labor, BD workers, etc. Especially 2008, there has been enacted an act, Unorganized Workers Social Security Act. It is to provide for a life and disability cover, health and maternity benefit, old age protection, and any other benefit as may be determined. And health insurance, in the form of health insurance, we have provided, especially India has provided Rashtriya Swasthya Bima Yojana, is health coverage scheme for providing a smart card based cashless cover of rupees 30,000 to a BPL family, of 5 covering all pre-existing diseases, hospitalization expenses and transport cost. Death and disability insurance, especially it is for Aam Aadmi Bima Yojana. It provides for death and disability insurance cover to rural landless households, rupees 30,000 in case of natural death, rupees 75,000 in case of accidental deaths, and total permanent disability and rupees 37,500 in case of partial permanent disability. Under the scheme, 2 children of the beneficiaries studying in 9th to 12th standard are given scholarship at the rate of rupees 300 per quarter per child. And handicraft artisans comprehensive welfare scheme. It has especially 2 components: Rajiv Gandhi Shilpi Swasthya Bima Yojana and Bima Yojana for handicraft artisans. The schemes covers, it is especially for the artisans family, especially covering the 3 other members of the family, and it providing annual health package amounting at 15,000, including rupees 7,500 for OPD, and insurance cover is available for the personal accident, death and disability for of the insured artisans. Only insured artisans are receiving this kind of help from the government. Another program for death and disability insurance is a national scheme for welfare of fishermen and training and extension. The scheme provides for the accidental insurance for the active fishermen. It is a saving cum relief and training cum extension facilities also. Another schemes, another social safety nets for the unorganized and formal sector workers is, we all know about the Employees Compensation Act, Employees State ESI Act, Plantation Labor Act, Maternity Benefit Act. These are the kind of social protection schemes for the organized sector. We all know. And we come to the new initiatives of the new government: Pradhan Mantri Jan Dhan Yojana, Pradhan Mantri Suraksha Bima Yojana, Atal Pension Yojana, Pradhan Mantri Mudra Yojana, Pradhan Mantri Sukanya Samruddhi Yojana, Jeevan Jyoti Bima Yojana. And this is another programs, newly implemented programs for the welfare of the citizens, especially Pradhan Mantri Jan Dhan Yojana is economic resources. It is also for the economic resources of the country should be utilized for the well-being of the poor. Especially it is launched for the 77,000 of areas. Especially it is launched in the 28th August in 2014. This is about PMGADY. Aim of PMGADY is to bring poor, financially excluded people into banking system. It covers both urban and rural areas. There are so many other programs in the in India. These are some of the examples. These are some kind of the examples of the social safety nets. These are the benefits of the people in PMJDY. Account can be opened with zero balance, not required to maintain any minimum balance. ATM card is issued. Accident insurance up to 1 lakh. Medical insurance coverage of 30,000. 5,000 of overdraft available only after 6 if your account is found. Rules for Suraksha Yojana. The scheme is a 1 year cover renewable from year to year. Accidental death and disability cover for death or disability on account of an accident. Death rupees 2 lakh. Total and irrecoverable loss of both eyes or loss of use of both hands or feet 2 lakh. Total irrecoverable loss of sight of one eye or loss of use of one hand or foot of is rupees 1 lakh. Premium is rupees 12 per annum. Eligibility conditions 18 to 70 years who give their consent to join, enable to auto debit as per the above modality. Termination of the cover on attaining age of 70 years. Atal Pension Yojana, it is implemented in 2015. Minimum monthly pension of the subscribers ranging between rupees 1,000 and 5,000 per month. That is a co-contribute pension scheme. 50% of the subscribers contribution or rupees 1,000 per annum. Government contribution also available. It is a scheme between the period of 1st June 2005 to 31st December 2015. Eligibility criteria is 18 to 40 years. Exit on attaining the age of 60 years. Exit before the age of 60 years, exit before the age of 60 not permitted. Another program is Pradhan Mantri Jeevan Jyoti Bima Yojana. Details of the scheme is all the saving bank account holders 18 to 50 years. Benefit 2 lakh is payable on members' death due to any reason. Premium is 330 per annum per member. Eligibility condition: the saving bank account holders of the participating bank aged between 80 years and 50 years who give their consent to join, enable auto debit as per the above modality will be enrolled into the scheme. These are the some of the scheme, and thank you for the attention of my class. This is regarding the social safety nets implemented in the in India, especially for the welfare of the citizens in the country. Thank you all.